The first case was the 45-year-old Australian man with the 7mm circumscribed scaly lesion, and this is an acantholytic actinic keratosis. Being fair-skinned and living in a sunny climate are major risk factors for actinic keratoses. This actinic keratosis is an acantholytic one. These are characterized by atypia of the nuclei in the basal layer with a cleft above it, and the cells above the cleft may lack atypia. The cause of the acantholysis is damage to the cells from sunlight, so this type of acantholysis is secondary acantholysis in contrast to primary acantholysis that you see in Pemphigus and Darier's disease. As we move along the basal layer, you can see that there is a degree of nuclear atypia in the basal cells. And here you can see that the cleft is suprabasal and that the nuclei of the cells above the basal layer are not atypical. The second case was the female of 40 on intensive care unit, and she had toxic epidermal necrolysis. In this condition, the bulla is subepidermal and there is necrosis of overlying epidermis. Here you can see that the cleft forming the bulla is beneath the epidermis. And as we move along the epidermis, you can see that it is focally necrotic. Case number 3 was the female of 47 with a flaccid, stinging and oozing bully on the trunk, and this is Pemphigus foliaceus. In this condition, there is acantholysis in the granular layer or immediately below it, and this results in a superficial, frequently subcorneal cleft. Immuno would show intercellular IgG in the epidermis. Here you can see the subcorneal cleft. The fourth case was the 25-year-old man with an itchy papulovesicular eruption on the back of the neck. This is Dermatitis herpetiformis. The fact that this patient has celiac disease gives away the diagnosis. Dermatitis herpetiformis is characterized by subepidermal blisters and neutrophil-rich microabscesses in the dermal papillae, and on immuno the dermal papillae show IgA deposits. As we run along the epidermis, you can see the microabscesses in the dermal papillae. And above the microabscesses, there is clefting in the subepidermal region. The final case was the male of 45 with the painful erosive crusted rash in the armpits. This is Hailey-Hailey disease. Hailey-Hailey disease is also known as familial benign chronic pemphigus. It is characterized by clefting above the basal layer and partial acantholysis, resulting in a very characteristic appearance of a so-called dilapidated brick wall or dilapidated stone wall. As we pan along the epidermis, you can see that the clefting is above the basal layer. And here you can see the partially acantholytic cells that have spread apart, giving this dilapidated brick or stone wall appearance.